you would initially go and see your GP. So the first step is to talk to your GP about any problems you might be experiencing, or talk to, say, an outreach worker that might meet you in the street. When that happens, you would come along to the hospital where you would be seen by a doctor and a nurse, and what they would want to do is talk to you about your drug use, how much you're using, when you're using. They would look at an average week with you, so they'd talk you through the last week and ask you how many drugs you were using on what days. And then they would take a urine sample and they would look to see what drugs are in your urine, so that they can be sure that the drugs you say you're using are actually there. Because sometimes people can think they're using certain drugs and actually not be using as much as they think they are. Once they've taken that, they usually take that twice to make sure. Then you would be started on a script, as it's usually referred to, so a prescription of methadone if you needed it. If you didn't, then you wouldn't be started on that. But if you were having any problems with your mental health, so if you're feeling depressed or anxious, then you might be started on medication to help you with that. Then the team would really be there to help you stop using drugs in whatever way they could. So that could be talking to you about your drug use, finding ways that they could support you to maybe get a house, to join some groups, to talk to other people about your experiences and see what helped them, and maybe that could help you. And then if you were feeling like you wanted to talk to someone a bit more in depth and a bit more privately, then you could see a psychologist, and they would be someone who you could talk to about that sort of thing.